my first question is about the word medicines, because I think it's very important when we are talking about psychedelics nowadays, it is to use this word medicine, because in indigenous cultures, they always have been medicines. Mm-hmm. And today we have a lot of confusion around this, because some people are calling them just simply drugs, as you know, but I think this medical aspect and that we humbly treat those plant teachers as medicines is very important. What do you think?
I agree. These are medicines. They were medicines when they first came out. They were medicines in common use when they first came out. Psilocybin was a medicine. LSD was a medicine. MDMA is a medicine. Ayahuasca is a medicine. Wachuma is a medicine. All these visionary substances are medicines, and they should be respected as such. And that's how we use them. We use them for a reason, and they are helpful for a reason. For some, they are helpful for a physical ailment. From some others, they are helpful for a mental health ailment. And for some, they're also an assistance to well-being. So they are certainly medicines, and they should be respected as such.
But when we are looking back to the history, and you also spoke about those 3 waves of psychedelic medicines, and the first wave is closely connected with the lineage of indigenous culture and indigenous traditions, and it concerns San Pedro, peyote, ayahuasca, also psilocybin in some way, and Amarita muscaria, which is common also in our forests. And why do you think it's so important today to acknowledge it? The aspect of this first wave and viewing it in contemporary science as well.
Yeah, well, it's really history is what it is, right? That we are where we are at because we build on the knowledge of others.
Something has happened again.
Yeah, there we go. Okay, I'm back. So these are important things because this is the history of our lineage, of our learning. So just like we would have learned from elders before, we would have been taught methodology, we would have been taught how to farm or how to make leather works, etc. Like these are all lineages, and only we have this blip in history where we created this different way, like in Western medicine, basically. And that is very beneficial. Like nobody's throwing that out. But what we're saying is there could be this holistic way of working with this, and why it would be asinine to ignore the knowledge that has been accumulated before and not build on it. And so if there are indigenous lineages that are unbroken, then we should learn from them and build on that and recognize that knowledge keeps morphing, like it innovates. Mm-hmm. It's not, knowledge doesn't stay static. So our indigenous lineages, mine is like Northern European, they were innovating all the time, learning more. And so let's keep leaping off of what they know. We in Western science shouldn't recreate the wheel on medicine ceremony because we already know what it looks like. We already know what it can look like, right? And so what we want to do is we want to do what our ancestors have done forever. They have culturally exchanged ideas. They have exchanged innovation. And that's what we got to do too. It would be, there's no reason, I'm at a loss for words why we don't acknowledge that. And in medicine, especially for me, I'm a better physician because I have good mentors and people that help me accumulate my knowledge. I do not just learn in an island all by myself. I learn because of the goodwill of my mentors and my colleagues. So it's exactly the same thing. So we're going to not ignore Indigenous historical wisdom, and we're going to incorporate it like we would have done always and make it better and innovate together, synergistically, sharing cultural ideas, sharing, hey, this works better. Like maybe this mushroom is better than this mushroom for this condition. So it's a logical way of collaborating across cultures and lineages and historical knowledge.
And I think it's very logical way also to continue the second wave of psychedelics when chemical molecules like LSD and MDMA came in, because in Canada there was, I think, a great practice in, you mentioned Weyburn Mental Hospital, and they already were treating patients with alcoholism with LSD, and also LSD. There was a hypothesis that having LSD treatment for people who are working with patients, it's a way to better understand the condition of psychosis. And there were hundreds of scientific articles published at that time, and then there was like this iron cut, and it all was kind of forgotten. And when we started this third wave, there were people who are saying there is not enough research on it, but there was.
Yeah, well, Weyburn was not a perfect example, but a great example still of these medicines being used. And there are people, you know, that are alive today who, because of their LSD treatment, went on to live wonderful lives, not being alcoholics. You know, like that we're able to see the seed of their trauma that they were using alcohol to soothe. And so to ignore that, like we have very few treatments that work well for alcoholism. We have very few really consistently useful treatments for tobacco use. So the reality is in our society, we use substances to soothe our symptoms. And what we do in our society is we try to treat that as if that's the problem. Whereas the problem is, what is the symptom coming from? If the symptom is coming from trauma or from social anxiety or depression that is coming from, you know, a terrible upbringing in your childhood, let's focus there. And that's what these substances do. That whether they're a chemical substance or they're a substance that comes from nature, they get to the seed of it so that the downstream symptoms go away. In our program in Roots to Thrive, we never treat alcoholism, we treat trauma. And then the trauma gets better and the alcoholism leaves. The smoking goes away. They start to exercise, you know, so that's why Weyburn was successful, right? They weren't trying to treat the symptoms at all. They were going like, let's treat something bigger than this. And those have shown, like I said earlier, in many of those patients are still able to talk about their experience about that. And you know, we're at the last lineages of the healthcare professionals that were working there. And so people like Dr. Erica Dick are spending a lot of time trying to have these interviews with these nurses and therapists and doctors and administrators that had those LSD experiences to try to model what people were going through. And of course, now we know that doesn't model what people were going through. It's completely different. It doesn't model psychosis at all. It models LSD. It doesn't model, you know, so we know that now, but you know, it changed a lot of people, and a lot of those people went on to do great things because of it.
Yeah, and then politics came in, and Vietnam War, and everything what followed. And now, also because of neuroscience, we know how our brain works, and knowing how our brain works, we understand how easy it is to manipulate with us. But to acknowledging it, I think it's a big step forward, because we somehow know it, and maybe we are getting smarter, where still there are instruments to manipulate, but we could maybe easily can recognize those manipulations. How do you feel?
Yeah, well, I mean, it's a challenging time because we're moving into a time where it is truly hard to know how you are being manipulated. And if we can just agree that, yes, there are people that want to manipulate us. Okay, we just agree on that. And whatever that looks like, it's true. Like whether it's somebody trying to sell us toilet paper or clothing or a vacation or politics, it's happening. And I think we can just put that over there and say, we agree, it's happening on some level. But that's not the issue. The issue is wellness. Mm-hmm. And these medicines can get us there. And so when we recognize that we are manipulatable, then the thing is, then how do we get good information? You know, how do I find good healthcare providers that know the science and know the data and are on my side as a patient or a participant? Like, how can I find a team that wants to get me well, right? And I think that's where, that happened, that propaganda happened, that stigma was created on purpose, and we can put that behind us now and move forward and say, look, we know these medicines work for certain conditions. We know they work for certain creativity. We know they can help people be better musicians. We know they can help with depression, anxiety, PTSD. So how do we get them to people? So I think really talking about the stigma and the war on drugs is interesting, but no longer relevant. It happened. We know it happened. Now what? So it's kind of like a so what, now what? What are we going to do with this knowledge? How are we going to move these medicines forward? How are we going to get them to people? And how are we going to navigate this spectrum of availability? For instance, in Canada, anyone can go in Vancouver to a store and buy mushrooms. You can order a mushroom growing kit off the internet, or you can get into the forest if you know what you're looking for and you can find them. The reality is they are out there and they are available. So then now it's really about how do we move forward safely and intelligently so that those who need them as a medicine can get access to them with a solid, good team that can support them. And then those who want to use them as a rite of passage, that would have been more traditional rites of passage, can use them safely. And those that even want to use them just for creativity, they want to be a better artist, they want to be more playful with their children, can use them that way. So I think that's what we do. We move the stigma, the war on drugs aside, and we say, let's show up as adults and recognize these are legitimate substances. The laws that prohibit them are prehistoric, really. Like we have to be forceful that way to politicians and say, this is ridiculous. We have laws based on propaganda. We must remove these laws based on propaganda, put them aside, and make regulations based on medicine and science. It is no longer acceptable for any of us in any country to accept laws based on propaganda. We have seen the absolute destruction in our world to laws based on propaganda. So let's grow up. And if there's politicians listening to this, grow up. Get rid of the laws based on propaganda and move forward with science. Like you can't say that enough to people. Like it has to be said from the patients, from policymakers, from the doctors, the nurses, the therapists. This is not acceptable. Let's get rid of that garbage and let's start from science again and Indigenous histories. Like that lineage of Indigenous history and science and research.
Yeah, because there is also an interesting example with the situations of terminal illnesses and end of life distress in Canada, because to get those medicines, patients were contacting Ministry of Health, as I understood, with and there were cases that it was allowed to use in proper setting together with therapists, and now you have returned to huge paperwork again, or the situation has changed. Could you say a little bit?
Yeah, it is still a
because...
huge amount of, it's still a huge amount of paperwork. And in Canada, what's happened is, you know, the decision to use these medicines is unlike any other decision. Usually what happens is a patient has a challenge, they have a conversation with their doctor or their nurse, and they make a plan and proceed with it. That's normal. In Canada, we have an abnormal situation where I, as a doctor, have to put in an application to Health Canada to people who do not know my patient at all. They don't know what's best for them. But I have to ask these people who are non-experts to give me permission to do where my expertise is for the benefit of my patient. So yes, we're still in this situation again in Canada where, you know, it's 8+ hours of paperwork and faxing, like, and then getting a whole load of questions back from Health Canada that have nothing to do with anything that's relevant. So it's frustrating. It's a waste of time. If I have to spend 8 hours doing paperwork, that is 8 hours I'm not seeing patients for, and that's not acceptable. And so again, it's still that situation in Canada. We are getting the exemptions from Health Canada, but they're moving slowly, and they shouldn't be. And we continue to send in the applications and talk with them and try to help them understand that this is not appropriate medical health care. It's just, and that's what it just goes down to, that simply. It is not appropriate for a physician to get permission from a bureaucrat to treat a patient. That it's just not acceptable. But that's what the situation is, and we'll keep speaking up against it while navigating it. And our program has, you know, had 40+ patients get accepted and get their treatment. And ultimately, all we are doing is trying to do everything we can to get our patients the treatment that they deserve and the treatment they want.
How maybe you can tell a little bit more about psilocybin treatment for end-of-life distress, because it's hugely important for many people, and actually it's like human right to spend your last days like a human. And I think this is what those medicines are allowing too.
Yeah, we in Roots to Thrive use psilocybin for people who have had a palliative care diagnosis, and we really actually try to get them access to the medicine well before their likely, you know, dying time. We want them to get it as soon as possible. So as soon as, and hopefully eventually you don't have to wait till you have a palliative care diagnosis to get access to psilocybin. But we apply as soon as possible. As soon as people indicate interest, then we start the application process for them, because it makes a difference to their health. They get better, like they feel better. In fact, some of our patients are in remission now and are living life, and they feel good. They feel happy. They are spending time with their grandkids and their kids and their families, and they're out there. Some of them have even gone back to work. So the sooner people can get access to this medicine, the sooner they can help release some of the traumas, some of the patterns that don't serve them. Maybe some of, and if them, we know that the whole body works together. So if somebody can use a medicine that helps drop their stress, and we know that if you drop your stress, you also drop inflammatory mediators in your body. So cytokines go down. And if we can drop that, and the body can get into a place of not being in fight, flight, or flee or stress, then it can use that energy to do other things. And maybe that means somebody can fight their cancer or interact with the cancer in a way that the cancer cells shrink. Maybe the immune system is healthier. Like this is all the scientific data we're getting, right? If we drop the stress, the immune system's stronger. So the sooner people get access to this medicine, if they want access to it, the better. And that's what we've seen in our program, that people, their lives turn around. I mean, people still die. We're all going to die. That's inevitable. But what we're seeing is people are healthier, they're happier, they're more engaged in their life, and in their mind, or in their mental health, they're not always thinking about their diagnosis. They can put it aside and think about, what do I want to do today? Maybe I want to go to the beach with my grandkids. You know, that's more important than always having this doom or this worry hanging over them about their diagnosis and what that means. So just to reiterate, we apply as soon as possible, as soon as people indicate interest, and then hopefully get them the treatment as soon as possible, as opposed to waiting. And we've had to wait so long that, in fact, some people have died before they've gotten treatment, which is not appropriate, not acceptable in any case that they have had to wait that long to get an acceptance.
Yeah, but you were doing group therapies, and what is advantage of group therapy in that case?
Group therapy has proven to be way more effective, and this is why. When we saw the data coming out of Johns Hopkins and NYU, we knew the results were good. We could see it, was being published. And in our program, we did all group therapy. And our thought immediately was that these patients, and this was already known from the Johns Hopkins, and many of the patients said one of the concerns they had was that, you know, they didn't really have anyone that they could really talk about it with or share with. And so they were trying to put some processes in that allowed them to get connected. And we thought, well, the best way to get connected is if people know each other right from the beginning and get connected in a community. And so we offered the group process right off the bat. And a number of our patients had already had individual sessions, and then they came into the group. And when we asked them after, when they finished the program with us, with Reach to Thrive, we asked them, which one did you prefer? And across the board, we heard something similar that sounded like this. I love my therapists that I worked with before. They were great. And I knew I was paying them, and they were being paid to be there. But with Roots to Thrive, I was with a group of other people that got what I was going through, and I could truly talk to them as colleagues. And yes, Roots to Thrive team members were there too, but they were part of the community. So it wasn't like a therapist talking to me. It was like me talking to a community and healing together. And being able to talk about things that I couldn't talk about with my friends and family. To open up and be really vulnerable and really speak about my fears and my concerns. And that in itself was so healing. And then to be able to have a psychedelic journey together with people. And then to come out of that and not only now be able to talk about the psychedelic journey and what they had learned in the context of having a palliative care diagnosis was so much more healing. And those people left the program with friends that got it. So many of them went on vacation together. Some of them went surfing. Some of them went golfing. Like they became a community. And that is perfect. That is exactly what you want as a healthcare professional. You want your patients to get well so they don't need you. You don't want forever patients. We want them to thrive and be well. So that's a group process. So we compared it a lot. We have done some one-on-one sessions with some patients, and the team agrees and the patients agree that the group process is way better. It's not for everyone, for sure. There certainly will be people out there that are like, no way do I want to be in a group. And then, so again, it's choice. So ideally, therapy centers have both. They have a group option, and they have an individual option. That's what we do. We have both, but the majority of our patients opt for the group because they want the community. It's not just about the psychedelics. The psychedelics is just a tool in a bigger process, right? It's just a tool that we use to help.
Yeah, in some way it's really a holistic approach because you have a therapist, you have a community, and also you have psychedelic, which is a tool. And I think it's very important in all situations because we are born to be in communities and to cooperate with each other. It's in our genome, and it's just normal that we are also at the moments when we are dealing with such difficult situations, we are in community, which is friendly and professional all in once.
Exactly. And that's really what we need. We need people there to support us and go, we got your back. We're here with you, and you can talk about anything you need to talk about. And the other thing that's really interesting is the group holds people accountable. So if people start to go back to their old patterns, the other participants are like, no. You said you weren't going to do that anymore. Like, they hold each other accountable, just like your friends would. Right? So it's not me, the doctor, saying, you weren't going to do that anymore. It's a participant that says it. So, and it's really powerful. It's really powerful. And most therapists that have worked in groups a lot really get it. Really get it. And I used to, before that, I used to always work in the one-on-one model. I would never go back to it because the groups are so much more powerful. You really see the healing amplify and move forward with a skilled team. It has to be a skilled team for sure. Our team is above and beyond on skill set, so it makes it, they make it look really easy, but the benefit to the participants is enormous.
One of the fields of your interest always was a chronic pain, and how helpful could be those medicines for such conditions, and because chronic pain, there are many aspects of it, and there could be also a psychosomatic aspect.
Absolutely. Chronic pain is complex, and that's why I love it so much, because it's really complex. And that was a part of why I got back into like the big interest of psychedelic therapy, because in my chronic pain clinic, there was a certain group of people that, we could get them like 50% better, but we couldn't get them the other part. And it was very clear that it was part of the mental health challenges that they also had, their anxiety, their depression, maybe their PTSD, maybe their upbringing. And I knew that if we could get them into psychedelic sessions, we could help them heal that. And then that somatic pain, which is completely real, they're really feeling it, but it's related to the emotional pain of their life, then we could help that. Because we already knew that there wasn't something physically, like it wasn't a broken bone or impinged nerve. We knew that like all that was right. And that the emotional part we weren't tending to as well. And so, and we already know, where we published a few papers on microdosing around chronic pain with Beckley. And, we see that in the real world, that even people that are microdosing psilocybin notice that their pain is better. Now, is that because they're mentally feeling better, more engaged in their life? Is it doing something physically? Possibly. I mean, it may take some time for us to really figure that out, but in the meantime, these people are doing better, which is really the goal of everything we're doing, is getting people better. And if we figure that out in the meantime, sometime, that's just a bonus, but as long as they're getting better without causing harm. So yeah, and we see that now in our program. We actually track that in our program. We're tracking people's pain as so people that have chronic pain that come into the program, even though the reason they come into the program is for depression, anxiety, PTSD, substance use, and addiction, and eating disorders, is many of them also have chronic pain. And so we've been following the chronic pain that they have as they go through the program. And what we're seeing is the chronic pain is going down, and it's changing. So they might come into the program with a lot of neck pain, but by the end of the program, they no longer have neck pain, but maybe now they're noticing their knee pain. So things are shifting. So as the tension and stress leaves, the neck starts to feel better in some people, because that's where they've been holding all their tension and it's painful. Makes sense, right? Gut pain. A lot of people have gut pain who have really high anxiety, irritable bowel issues, biome issues. And when the stress starts to come down, they're no longer reporting abdominal pain. And so it just shows that we're mind body, right? It's all interconnected. And certainly for chronic pain, these medicines are going to help for any element of it that is that mind body element of stress. And I think this is a really interesting area going forward, is really understanding that a lot more. Like, I think, with Chinese medicine and acupuncture, they've had a lot more understanding of that than we have. So again, it goes back to one of your original questions about that indigenous lineage. That lineage of knowledge is starting to integrate that to go, oh, we know these parts of the body hurt when somebody is going through these types of mental health challenges. So how can we treat the whole person? And in some cases, like, great. Really great choice for that, whether it's a big dose, a medium dose, like a mini dose, or a micro dose. So micro, mini, macro. I think that's the interesting part of science, is figuring that part out for people, helping people figure that out.
But speaking about chronic pain till now, what is your viewpoint? Which from those medicines is the most effective, psilocybin or others as well, MDMA?
Yeah, good question. We studied, we looked at the MAPS MDMA. We published on that, myself and one of my colleagues, Dr. Christie. We looked at the MAPS MDMA data because they had collected pain scales in the data and hadn't published on it. And so what we found when we looked at it is, interestingly, that people that had really high PTSD, nothing really changed for them at first. And our theory is it's probably because they were so much in fight or flight flee that it was hard for anything to change. But as people's PTSD came down, then they could feel their bodies more. They could feel the pain more that they were experiencing. And so people in that middle range of PTSD, as they got better, their pain got better. So certainly it's interconnected. So we know MDMA helps. I think that we will find all of these medicines, any of them that get to the seed of the trauma, will be helpful. Definitely that's psilocybin, definitely that's ketamine. And the interesting thing about ketamine is we know it works for pain and we know it works for mental health conditions. So it's a real logical place for people to work with immediately, because ketamine is, a WHO essential medication that's available to physicians and healthcare providers all across the world. And I think we're really going to see that more and more with psilocybin. I don't know about LSD. Like, I don't know if there's any data out there around LSD. I haven't done a dive into it, but I suspect we're going to see the same with LSD. I mean, if LSD can help with alcoholism, then, other symptoms related to that, like the trauma that causes alcoholism or the trauma that causes tobacco use, you would think that would be logical that we would see that. So I'm quite hopeful. I'm quite hopeful that we'll see a combination, especially in the two areas that we struggle with the most in medicine, mental health, chronic pain, that these medicines are going to help a lot there. And so the long answer that I think all of them are probably helpful somewhere in the chronic pain spectrum. And it'll take more data, or people talking about where they've had success, and for us to help bring those into clinical trials.
So at the moment, of course, when also mainstream media all over the world are talking about psychedelic therapy, there is a lot of hype around this as well, but it's very important to not forget that there is always purpose why you start to use them, and afterwards there is integration, and in between there is set and setting. And what I would like to ask you about education, because we need psychotherapists who can work with those medicines, and this is a huge educational work. And what is the situation in this field now?
Yeah, there's a lot of universities working to bring good curriculum forward. We have a program in British Columbia, the Vancouver Island University has a psychedelic assisted program for professionals. So right now we have doctors, nurses, social workers, therapists, Indigenous knowledge keepers, all training together in a one-year program. Of course, psychedelics is much larger than that. It's not a one-year program. It's probably like a 2-decade program, really, if we look at it honestly. Coming together and they're learning from each other, and we see that in universities. I'm sure closer to where you are, you're going to see a lot more, and there's certainly a few in the US as well. So that's a start. I suspect, and it should be happening because the students want it, that medical residents interested in psychiatry and interested in family medicine and interested in chronic pain will be demanding that their medical schools start teaching about these medicines. So that's a logical place for people to start learning more about these different medicines and what may be useful. Of course, therapists and psychologists should be demanding of their training programs to start putting this in. So I think we're going to see a proliferation. I think every university that has a medical program will start to bring in psychedelic medicine. I think those that aren't thinking about it yet are a bit behind the curve and should start thinking about it, about how they're going to start bringing in some classes to teach. And for people in areas that don't look like there's going to be something like that anytime soon, what I suggest is that they get together and create professional learning groups. So that's where we started. Where I am is we were bringing together 20 doctors who were interested, and we just all talk and learn and ask questions and share knowledge and look at journal articles and interpret them and go, how would we treat a patient if they had this? And so learning from each other. I don't think anyone should work with these medicines by themselves. I think you should definitely be in teams. So if you're a doctor, you should be meeting regularly with a team of nurses and therapists and social workers and pharmacists so that you're all learning from each other. So I think there's a lot of options. So if there's programs near you, great. I would highly recommend that people interested in this get in these programs and get into learning groups, where we call them here consultation groups or accountability groups. And, we run about 5 of them a month, 5 different ones where people can come and bring questions, bring data, bring research. They can get to know each other. They can form their own teams. And I think there's a lot of ways. And that kind of goes, again, back to the Indigenous lineages, right? Learn in community, learn from others, keep learning. And keep your ego in check, that you never, ever think you know it all. And I think that is the biggest part, is that we are all lifelong learners, and there's always more to learn. We have never finished learning in this, and really, truly be always apprenticing with somebody who's smarter than us, and be mentoring people that are still learning. So that it's a continuum of learning. So whether that's in a university or college or in the community or in these learning groups, that we keep doing that we keep recognizing that we're better together, we're smarter together when we learn from each other. And there's a lot to learn. We don't know. Like we're really only at the baby stages of learning all of this.
Yeah, and it also teaches us like a synergetic approach to communicate between different disciplines, what we forgot for many years because all of us were each in their own box and communicate just inside our bubbles. And now we are just starting, maybe thanks to those medicines, to communicate more with each other and to break up those hierarchies sometimes.
Yeah, we need to. We're always stronger together. And we're always stronger with diversity. So having diverse fields coming together is exciting, because you get to learn from people that know so much more about something, and it's fun. And then you have colleagues that you can call. You can pick up the phone and phone a pharmacist and say, can you help me with this patient? They have a lot of medications. What do you think? Yeah, it's a lot of fun. I love Roots to Thrive for that reason, because we have so many disciplines on the team that we're always in the privileged position of learning from each other.
I would like to ask you also about microdose me, because you are one of the co-investigators there, and I think there are ongoing study with 20,000 plus participants. And what exactly are your findings till that moment?
Yeah, there's 25,000 people. Yeah, 25,000 people now, more than that actually, enrolled in the microdose.me study. And we have 9 now, different little research pods that are looking at the data. And so we're looking at, we've already published twice in Nature scientific reports, and on the data that showed people's mood gets better. So depression scores go down, anxiety scores go down, positive moods, so just thoughts go up, people become more positive, and people who are prone to negativity goes down. And we also published on reaction time. So the TAP test, where people tap their fingers, which is a test we use in Alzheimer's, Parkinson's, other types of dementia, other type of neurological conditions that record, the rhythm and the frequency, how fast you can tap. Like we showed that in people that are over 55, that microdose with psilocybin, niacin, and lion's mane, they get faster, which is like, that is, it's very interesting for neurological conditions, that people can actually regain some function that maybe we thought you would not get. So that's pretty exciting. And then what we have right now is these other groups on our team are going through the data to look at around traumatic brain injury, to see what we're seeing there. Some sexual dysfunction stuff is being looked at. Pain is being looked at more closely, and also what are the combination, like what are the dosing regimes people are using. So and the thing is, it's all over the place, which is really interesting. So some people will only, like women may only microdose like 4 or 5 days a week around their period to help with those symptoms, and then the rest of the month they don't. And then there may be other people that are programmers and have a real issue with their attention, and they may be microdosing every work day but not on their off days. And so we're looking at that as well, trying to figure out what are the patterns, and what are the frequency of those patterns, and what are the doses people are looking at, because it's all over the place. Everybody's and that's kind of the interesting and exciting thing I find a lot about microdosing. Like, what if there is this treatment that the patient can determine themselves when they need it? That you could sit there and go, you know what, I'm doing pretty good, I don't need it. And then, oh, I noticed my mood's down, I'm going to start microdosing again. Or, and in some people, maybe once we hit 55, we all want to microdose. Maybe we say, you know what, after 55, you should microdose because you won't fall as much. Your reaction time will get better. And maybe I'm hoping that we'll see things like maybe improvements in vision and hearing, because everything in the microdose.me study is there because somebody has said, I have been using microdosing for this reason and it was helpful. So we had like hundreds and hundreds of case reports ahead of time, where people were sending in their case reports saying, This was my issue. I heard about microdosing. I started microdosing, and this is the result I got. So we had lots of these anecdotal N of one reports. That helped inform it. So that's what we're looking at. And, you know, as you can imagine, that's millions and millions of data points in there. And our team, most of our team is volunteer. You know, we don't have there's not a lot of money involved in this because there's no, you know, patentability for a lot of it. And so it's really the love of science that drives the microdose team. You know, Quantified Citizen has been just an amazing partner in this as data scientists. And it's really a whole bunch of medical doctors and neurologists and psychologists and researchers that are just super interested in the science and helping find better solutions for people to feel better.
Yes, and it seems that this third wave, at least at this moment, is unstoppable. But at the same time, we should think also about the risks and mistakes to avoid. What could be the main, from your point of view, main things to avoid and main risks?
You know what? The reality is it's a different time than before. And I don't think there's any going back. So I think the best thing we can do, like I said earlier, is we need to make sure that however people are getting these medicines, whether they're getting them from healthcare providers or whether they're getting them from a store or on the internet, that we make it as safe as possible. If we have to learn from the tainted, like in Canada, the tainted drug supply, and in the US, with people dying from tainted drugs, that is a direct result of the system not providing safety. And that is really, I think, where we should focus on not to reproduce, is prohibition causes the underground to thrive where there's no safety. So let's get rid of prohibition. Let's get these medicines available in a harm reduction approach in the safest way, so people are not losing their loved ones to tainted drugs or to unscrupulous people providing it. I think that is, I don't think the lesson is from the 70s. I think the lesson is from right now. Prohibition doesn't work. Criminal justice involvement in these medicines doesn't work. So if we remove the prohibition and we remove the illegality of it, then we can show up like the adults we are and find a safe way for people to have access to these, because they have access anyways. You can't stop access. It's there anyways. And then we can have options of providing it as a medicine or providing it as, even if it's used recreationally, let's make sure it's provided safely so nobody's children die because of tainted drugs. And then we'll be fine. We'll be fine. People have always wanted altered states. And we allow people much more dangerous altered states in the form of alcohol. Number one, if we really want to get rid of anything, that's the one we get rid of. And we open up the door to all these other ones, you know. And that's really the only option. The only option is safety, harm reduction, and going, how can we make it safer? That's the thing, not to reproduce. We're not the people that lived in the 70s. People always are going to want some sort of intoxicant. So let's make sure it's safe. Whatever that intoxicant is fine. And then when we use it as a medicine, great, let's figure that out. We're smart enough to do this.
Yeah, and we are smart enough to approach them also in humble way, as they deserve, as their medicines, which are part of our ecosystem.
Yeah, and our politicians and our policymakers have to we have to hold their feet, you know, to the fire and say, do you want to put more people in a healthy situation or in a prison? Right? And I would hope that their decision is, I want a healthy population. I want people that are healthy, loving, caring. You know, the criminal justice system is not the way. If we made all of these things legal today, you'd get rid of organized crime, right?
Of course.
There's no profit there. They'd have to be legitimate businesses that would have to follow legitimate rules. It's an easy win. You just cross the board, across the whole globe. Get rid of it. Just get rid of the laws and then find healthy ways to regulate and make it safe.
Yeah, and maybe put a proper tax on them or some things that are open and have more money in your in country.
Yeah.
Of course. Absolutely. And the last question I want to ask you is a little bit personal. What you learn for yourself from those medicines, maybe 3 most important things. Working with them already for quite a long time.
Yeah. One of the many things I've learned, it's really hard to choose through. One thing is that we are very similar. We struggle with the same challenges and they're fixable. So psychedelics can really help people realize that they're lovable, they deserve love, they deserve connection, they deserve to help and to be helpful, and that we are really all connected. We are more similar than we are dissimilar, and we don't have to agree on everything. We can agree where we agree and be creative together, and where we disagree, we can let it go. So that's a really common thing that I've learned, and I see a lot of my patients, is they come out of it and they are more connected to love of themselves and all the things they've been beating themselves up over about not being smart enough, not being good enough, not being thin enough, not being tall enough, smart enough, you name it, anything. They start to realize that that is a story that they have been carrying that's not true. And myself, that has been a really solid learning for me. And the bigger learning that came from that is the healthier I am, the more I take care of myself and the more I take care of my physical body and my mental body and my spiritual body, the better of a human I am on this planet. And I'm a better doctor for my patients, and I'm a better friend, and I'm a better family member. And so these medicines help us to really become ourselves and clear out all the, for lack of a better word, the crap that is just crap. So that has been a really big message for me. And having been a city firefighter before and having gone through medical career, like training, which is very traumatic, that these medicines help me go through all of that and come out very healthy and be healthy and know that I have the right to be healthy. And so those are the lessons, that I belong, I'm meaningful, I have something to give to this world, and so does everyone else. And we're better together in community, you know, with love, with an open heart and coming together. Those are some of the strongest messages I have learned, and that everyone has value.
Thank you very much. It was really nice ending, and I think we all have rights to be healthy.